We've had this opportunity to collaborate with and have a relationship with the Mayo Clinic. And with me today is Dr. Mark Larson, GI doctor and the medical director for the Mayo Clinic Care Network. And Mark, welcome. Thank you for being here.
Kevin.
Couldn't be more excited about this, and really just want to hear in your words about this opportunity, and maybe start with why Hendrix?
There's lots of reasons why Hendrix. So this relationship began a long time ago with connections to Mayo Clinic through you and some of your colleagues. But as we got closer to thinking about what would a formal relationship look like with the Mayo Clinic Care Network, it gave our teams a chance to really dive deep into Hendrix, to understand your leadership team, your mission, your values, your culture really. And we saw that all of that very much lined up with that of the Mayo Clinic. You know, you're a patient-centered organization. At Mayo, we like to say that the needs of the patient come first, and that's exactly what we saw at Hendrix. We did have a chance to kind of dive deep through due diligence to understand your safety, service, outcome scores. They're all outstanding. We really thought this was a fantastic match of Hendrix values and culture and patient-centered care with that of the Mayo Clinic. And we think that the resources and knowledge and expertise sharing that the Care Network can bring to Hendrix will really be valuable to you and your providers and your community.
So this means a lot to us as an organization, and it means a lot to our providers. Could you give us some sense of what does it mean for a physician here at Hendrix? What will they have access to now that they didn't have access to previously?
Let me give an example. I'm a gastroenterologist, so I see patients, I do procedures each and every day. And the tools and the services and the colleagues, the camaraderie, the educational opportunities that I have available to me every day at Mayo Clinic, I think are really important to keep me on the cutting edge and to allow me to do the best I can for each patient that I see. Those same tools and services, that ability to connect with experts to offer counsel on patient care activities will now be available to all of the providers at Hendrix Health. So through this electronic technology that we can now really leverage, we'll be able to connect Mayo Clinic physicians and experts with Hendrix Regional Health physicians and experts. Your team is outstanding. You've got outstanding physicians here, administrative leaders, nursing leaders, but now they can connect with a relationship with a partner at Mayo Clinic who can also counsel, advise, give them advice on complicated, serious care. Perhaps something that they've never seen before that we see a lot of at a place like Mayo Clinic. So I think it's really collaborative in the sense that we're working together to advance patient care through these connections.
How does that help us keep patients close to home, help avoid an unnecessary transfer, keep that patient where the care is close to their family at a low-cost, high-quality model?
The relationship is critical to this venture that we're now entering into. Mayo Clinic has, for 150 years, in our culture, in our DNA, we've provided connections and consultation and relationship building to providers from all over the world in the care of complex patients. As you mentioned in our history, the Mayo brothers traveled the world. They learned from other providers and experts. They brought that expertise back, and they invited others to come back to Rochester and learn from their expertise and skill sets. So for example, a cancer doctor who has a really complex, difficult tumor, they'll be able to connect with a Mayo physician and offer a thought such as, is this resectable? What would be the next form of chemotherapy or radiation therapy that might be applied? After a surgical resection, now what should I do? You know, that type of longitudinal care of the patient helps to keep patients locally where they're with their trusted provider, they're in their community, where they're supported by their family, their church organization, those critical members of their support system.